Hello, my name is Ron. I'm here as a patient of Dr. Kaz. I've got a little bit of a unique history before I came here. About 2.5 years ago, I went in to an endodontist for a root canal. He did an x-ray of the 360-degree x-ray and not the problem that I had with that particular tooth he fixed, but he did it so he can get a better picture or x-ray of the abscess tooth. And anyway, when he was done, he came back in and he says, listen, he says, I got a little bit of a story to tell you here. He says, you've got some issues you need to get corrected. And he went on to tell me that I'm probably need to get an implant done, that I had a lot of bone loss in my upper jaw, my left side, and he recommended that I talk to my dentist. And I was going to my current dentist and also a periodontist, alternating back and forth, and they had never caught it. And ultimately what happened was I had decay underneath that tooth that had taken out the tooth next to it. It was a low-level infection, and he caught it, the endodontist did. So I went back to my dentist a few weeks later to get the permanent filling put in from the root canal, and he did not have a clue what was going on. So after talking to the endodontist, he referred me to another doctor that the procedure was a lot more complicated than strictly an implant, and it required a restoration of my upper jaw, which I didn't realize is very close to your nasals, and it's not a procedure that's done every day. So after talking to him, he said he could do the restoration, the bone restoration. However, I'd have to go to somebody else for the actual implant, and then back to my dentist for the permanent. So I thought, well, before I go through all of that, I'm going to start interviewing doctors, and which I did, and none of them could do the work or wanted to do the work. They weren't comfortable with the procedure. If it was a lower jaw and not up into the nasal passage, they were willing to do it, but this one they would not. So I happened to see in a newspaper article a seminar that was going on here, and so I came to it one evening, and I got to talk to Dr. Kaz, and I had a appointment set up to go in and see him about this. Now, I didn't say anything to him about what I had found out already. I was just curious as to if he could handle it, and he did. He says, not a problem. He says, but he says it's going to be a multi-step procedure. And I said, do you do the bone restoration and the implant? He says, yes. He says, I do everything. I had 2 upper molars extracted, and after the infection went down about a month later, I came back in. He took a look at it and scheduled me for a bone restoration. And he performed it perfectly. Then I came back about 4 months later for the permanent implants, and in the meantime he had done some work on one of the teeth on the other side on a gum, and so in essence I got rid of my dentist and my periodontist both, and Dr. Kaz has been doing all my dental work. Not that I've had a lot since then, but everything's been great, and I'm much appreciated for his skills and his honesty. I was extremely surprised on how well their hygiene is. When I went through this procedure, they had basically wrapped me so there was no chance of getting infectious from anything else into that bone transplant and so on, and staff has been great, very professional, always on time, and virtually no pain at all. I've not witnessed any discomfort afterwards, or nothing that a couple aspirin couldn't take care of the day of the procedure. So It's been great. Like I said, Dr. Kaz and the staff here are absolutely great to do this restoration work, because there's very few doctors that are capable of doing it. And it was a 3-doctor process. And when I found Dr. Kaz and looked at his credentials and what he's capable of doing, it just absolutely convinced me this is the doctor to go with. So very well taken care of, surprised, and his professionalism is beyond anything I've had to go through as far as anybody taking care of my teeth, transplants, so on and so on. So very well happy.